Hi, I'm here with Amanda Parker, Chief Financial Officer and Senior Director of the Ayaan Hirsi Ali Foundation. Amanda oversees Ayaan Hirsi Ali Foundation's women's rights programs. And I'm also here with Ken Ivory. He's currently an adjunct professor at Utah Valley University, where he teaches American federalism. He also served for 9 years in the Utah House of Representatives. He resigned in August 2019 to join the staff of Geomancer Incorporated. And most importantly to ALEC, he serves as the chair of our Center to Restore the Balance of Government. Yesterday we had a really important session where we discussed female genital mutilation, or FGM, in the States. And for those who weren't able to make the session, we wanted to hit some of the most important points. So first to Amanda. Can you describe what is meant by female genital mutilation, FGM? Because I think sometimes it gets confused with male circumcision.
Thank you so much, Karla, and thank you so much to everyone at ALEC and to Representative Ivory for having me here today to talk about this really important issue. Female genital mutilation is the process where a little girl is taken behind closed doors. She's held down, her legs are spread apart, and a sharp instrument like a razor blade, a pair of scissors, or a knife is used to cut away at her healthy genital tissue. In the most extreme form, everything, all of the external genital tissue is removed, and the wound is sewn almost entirely shut with just a small hole left for urination and menstruation. There are no health benefits to this process, and there are lifelong health and psychological harms that are associated with female genital mutilation.
How prevalent is this practice in the United States, and is it restricted just to certain communities?
Most people think of female genital mutilation as something that happens somewhere else, somewhere over there. But the Centers for Disease Control and Prevention estimates that there are 513,000 women and girls who are at risk of or who have undergone female genital mutilation here in the United States. And that number is an estimate of women and girls who are here in the United States from countries with high prevalence rates. So for example, in Somalia, 98% of women undergo female genital mutilation. In Egypt, 90% of women undergo female genital mutilation. But this is a cultural practice, and it's not restricted to one religion or community. It's a practice that predates all major religions, and no major religion mandates female genital mutilation. In Ethiopia, for example, where 74% of women undergo female genital mutilation, this is something that happens to Christians, to Jews, to Muslims. It's not restricted to one religion. And in addition to that, I am working in the United States with Christian white women who were born here who have undergone female genital mutilation because their families believed that sexual pleasure for women was a sin. So this is something that, while people think of it as happening somewhere else and to one particular faith, that's not the case.
And Representative Ivory, how did you first hear about this?
Yeah, it's a great story. I was actually sitting next to Amanda at a leadership lunch at the American Enterprise Institute. And she introduced herself and told me what she did, that she's working on banning this practice of female genital mutilation. And I've done a lot of work on preventing childhood sexual abuse and restoring victims' rights, and I was grateful for what she did. And I mentioned to her, I'm so glad we don't have that problem in Utah. And she got on her phone, and within about 10 seconds, she said, you have 1,800 girls at risk in Utah. And my jaw completely dropped. I was astounded. I immediately called our legislative council and started working on the bill, and just honored to work with people that are so devoted and dedicated to protecting children. That's what government's about: protecting life, liberty, property, particularly protecting those that can't help themselves.
And you brought this to the ALEC Task Force on Federalism.
Right.
What makes this a federalism issue?
Yeah, that's another amazing story. So the month after we met, so November of last year, federal district judge in Michigan struck down a federal ban on female genital mutilation on the grounds of federalism. And he said our nation, this divided sovereignty, reserved the police power, protecting health, safety, welfare, exclusively to the states. It was something not possessed by the national government. And so, as abhorrent as it may seem to strike down a law that would protect children, constitutionally it's the right answer. And so combining those things of this is why we do what we do, and at ALEC we stand for limited government, free markets, and federalism. And when federalism means protecting children, what better thing can we do than to step up and exercise the power that we have as a united group of state legislators? It's a quintessential federalism issue, because if we don't stand to protect the people in our states, that's where the federal government does come in, and they do encroach. And so it's our job to step up and protect, particularly defenseless, innocent little girls from just outright barbaric torture.
And Amanda, which states still don't have laws to criminalize FGM?
Right now there are 35 states that have specifically banned female genital mutilation, but the states that haven't yet are Alabama, Alaska, Connecticut, Hawaii, Indiana, Kentucky, Maine, Massachusetts, Mississippi, Montana, Nebraska, New Mexico, Vermont, Washington, and Wyoming.
And I know you've mentioned that I think it's 500,000 American girls are at risk in the United States. How do you come up with that number? What makes a girl at risk?
The way that number was estimated was the Centers for Disease Control and Prevention looked at the number of women and girls coming from countries where there are high prevalence rates and estimated, based on immigration rates to the United States, how many women and girls are likely to be at risk here in the U.S. However, that number doesn't include women like the white Christian women I'm working with here in the U.S. It also doesn't include the Dawoodi Bohra, who were part of that case that Ken mentioned in Michigan, where the federal law was struck down. So we know that that estimate is not including all of the groups that really ought to be included, and a lot of advocates think that it's really just the tip of the iceberg.
And Representative Ivory, did you face any hurdles getting the legislation across the finish line in Utah?
You know, we really didn't, Karla. It was really a gratifying experience. It was a very unifying experience. In fact, I had the county attorney, completely different political ideology standpoint, came in and he said, no, we need to stiffen the penalties. These aren't strong enough. And just overwhelming support. And so we were able to work with child abuse groups, sexual abuse groups, victim advocate groups, and really just united, I believe. I mean, you probably know better than I do. I think passed unanimously, House and Senate. Every committee passed unanimously. It was really, like I said, a very unifying experience to it's the best of what we can and should be doing in state government.
And this question is for both of you. Why do we need specific laws to address FGM? Why won't existing laws on child abuse or assault, why aren't those sufficient?
Yeah, I think what we did in Utah is we also provided a private right of action. The problem that happens with things like this is victims are conditioned and threatened that it's bad to tell. Like in all child abuse situations, that seems to be the common denominator. It's bad to tell. People won't believe you if you tell. You'll be ostracized if you tell. And so because it's something that exists in darkness, to really bring that light out of it, so not only victims have a remedy and a private right of action, but the medical associations, the health departments, the state legislators, the police, that they understand that this is a very particular and very serious issue that by its very nature, its tendency is to be concealed, and so it brings that to light.
And Amanda, are there other reasons?
Yeah, I absolutely agree with what Representative Ivory said, but I would also say that in addition to that, the reason to perform female genital mutilation on a little girl is to control her sexuality. But parents aren't doing this because they want to harm their daughters. They're doing it because they think that it's the best thing they can do as a parent. And many existing aggravated assault codes, for example, have intent to harm as part of that. And there is no intent to harm when female genital mutilation is performed. Another reason is that it really it sends a strong message that this is something that's not acceptable here. And as Representative Ivory mentioned, there are lots of other provisions besides just simply banning it we're hoping to prevent this. We want to educate communities and professionals about the harms that are associated and penalties that are associated. We want to make it illegal to take a girl outside of the state for the procedure. There are a lot of things that we need to do really to attack this issue, and it's more than just banning it.
Yeah. And I'm wondering if perhaps for a mother who's on the fence, being able to say, hey, it's illegal, that's why I can't do it, might help give her a little more courage to stand up.
Absolutely, and that's a terrific point. That's actually something that happens with us at the AHA Foundation, is that women and or mothers who are on the fence about whether or not to cut their little girls use existing laws as a reason to family members who are pressuring them as to why they can't do this. So it is absolutely a tool that parents who are resisting doing this can use to help protect their daughters.
ALEC adopted model policy this past summer to criminalize FGM. Are there ways that this model policy could be made stronger? And that's a question for both of you.
Yeah, I think one of the things I mentioned was the private right of action. We didn't include that in the ALEC model policy, really just for expediency. We wanted to get the model policy passed and moving. We would have had additional work to go through for that. But the private right of action allows a victim to enforce the statute, whether a prosecutor does or not. It allows them to get redress, and we included the whole range of civil damages: exemplary damages, compensatory damages, punitive damages, treble damages, legal fees and costs. And I think that really makes it self-enforcing. We also included some education provisions, so through the Department of Health and the outreach and education that can happen and should happen through medical associations and those sorts of things.
The only other thing that I would really say to add to that is that at the AHA Foundation, we encourage legislators to include female genital mutilation as part of mandatory reporting. And that's going to look different depending on the existing code for every state. But we think that female genital mutilation should be included as a mandatory reporting issue.
Well, thank you both for joining us on ALEC TV. And if you have any other...
Can I just add one more thing, if you don't mind?
Absolutely.
First of all, thank you for your tireless work in moving this and working this through ALEC. And to Amanda, I'm just inspired at what you're doing to help and bless and protect children. I mean, that is so critical. And to our colleagues at ALEC, this is federalism, protecting children. This is in the purview of the states. This was reserved to the states. This police power to protect health, safety, and welfare is reserved exclusively to the states. And so it's our duty and it's our obligation, and we're calling on you. If you have a female genital mutilation ban already, it can be strengthened. Get a hold of Amanda and the AHA Foundation. If you don't have one, please reach out. And we'll help you. Amanda is wonderful. You have a turnkey package to have a marvelous unifying legislative experience, and we're asking you. This is the best of what ALEC does in limited government, free markets, and federalism. And I've committed to Amanda that we're going to make this happen, and so let's honor that commitment.
It has been a privilege to work with both of you. If you need to get in touch with me about the ALEC model policy, kjones@alec.org. Amanda?
I'm at Amanda at theahafoundation.org.
Yeah, I'm always happy to help. Vote Ivory at gmail.com.